many times we've seen our father go under the knife.
One more and I get a free hysterectomy.
Bodily mix-ups, basketball boo-boos, and stealing the devil's girlfriend. Today we're back at it, breaking down and reacting to all of the hilarious medical scenes and off-the-wall injuries from The Simpsons. Let's make like Homer and dive right in.
Dr. Nick Riviera. Remember me?
Well, if it isn't my old friend, Mr. McGregor, with a leg for an arm and an arm for a leg.
Attaching different appendages, an arm, like, obviously that's not what we normally do. If somebody loses fingers, maybe a thumb, sometimes they're actually toes get transplanted up into the hands to help with the dexterity of your hands versus your feet.
I'll heimlich you, sir. Just be still so I can embrace you from behind.
So heimlich maneuver, typically you're going to ask somebody if they're choking. Universal sign for choking is this. Tell the person that you're going to do the heimlich maneuver. And so you actually take one of your fists. You want to put it in your subxiphoid area, grasp it with the other, and you're doing thrusts to pull in. And the idea is that you're trying to actually expel it out.
You're safe now.
Yeah, no. If somebody passes out, you do not lay them in this type of position. You put them on their back and you actually start doing the same type of thrusts into the same area.
Eat my dust, mortals!
Oh! Getting the leg stuck in the rim, you could dislocate the knee, or you can fracture the tibial plateau. You can fracture your patella, which is your kneecap, and then possibly femur fracture, but that would be pretty hard to do in that situation. Oh my gosh! Falling down. Obviously, hitting the head, compressive force could break it further, can cause compartment syndrome of the lower extremity there, where the tissue swells so much that you can't get blood flow to the distal tissue, and then it's a surgical emergency. It needs to be cut open.
Homer, I'm afraid you've torn out your anterior cruciate ligament.
There you go. Nice. So if you do rupture your ACL, there's going to be a ton of swelling. If you have partial tears, not as much swelling. The knee is going to significantly swell, a lot of pain. You want to get the MRI to get a definitive diagnosis, but with so much swelling, it's initially hard to see it.
Now, how did this happen?
Maybe a little morphine would refresh my memory.
I talked about this before. We don't randomly just have syringes of morphine in our lab coats. At hospitals that I work at, there's a Pyxis machine. It's a brand. It is a locked unit where the medications are. Emergency medicine doctors do not have access to that. Only the nursing staff does.
I don't know. I'm still a little hazy. Oh, yeah.
Morphine hits the mu receptor, which tells our body not to pay attention to the pain. I love these scenes, these OR scenes. Your arms wouldn't be exposed, you'd be in a full gown, and his airway would be protected either with an intubation, an LMA.
So many times we've seen our father go under the knife.
One more and I get a free hysterectomy.
Punch card for a free hysterectomy. Hysterectomy meaning removal of your uterus. They're in a viewing area. Typically you wouldn't have that for families, but in teaching hospitals, big university hospitals, they do have these areas where students and residents and other supervising doctors can view the surgical room.
Now, Homer, you'll have a full recovery from your spinal cord injury.
What spinal cord injury?
Oh, he fell off the gurney.
A gurney is a fancy word for basically a hospital bed. Many of the hospitals I've been around, they do everything humanly possible to prevent patients from falling. Very rarely does it ever happen.
But it will take plenty of time and rehab before you can go back to work.
Miss work, but my life would be nothing without the nucleon plant.
After you have major surgery like that, especially in orthopedic surgery, rehab is really important. You want to strengthen everything around the injury. That way you give it the best support so it can have a longevity.
Oh, you're also responsible for this hefty hospital bill. You shouldn't have ordered all those hospital haircuts.
You have a hospital bill. I don't think I've ever actually seen one for one of my patients. That is a different department. It's a billing department. Obviously, hospital bills, it's always a point of contention. It just depends on the plan with the hospital, insurance, in-network, out-of-network, all different things, what country you live in. It has so many factors.
Well, you don't have to worry about the bill. We've never welched on a... Look, a bear! Run!
Oh! And there's a bear.
Oh my God, bear's driving!
Now, have I ever seen a bear come to the emergency department? No, obviously. Most of the wildlife injuries that I see are potentially rodents, dogs, anything that somebody might have in the house, a cat. Typically, you're not seeing too many wild animals. Whoa.
Wow.
Looks dry.
Yes. You're gonna immediately cause burn wounds to your tissue if you try to go down this. Flesh is gonna come off. Oh, jeez. Oh, all right, we got water flow. Woo!
Children, behold the deluge. For today we punch fear in the face and steal death's girlfriend as we truly live for the first time.
Oh, only one way down now. If that were to happen, how many of you out there would figure out a way to get off of that or go down the slide? Let me know in the comments. Oh my God, I don't think that is safe. I'm not telling anybody to do this. At least you're on the mat, so you're not getting burns to your own tissue underneath, so that's probably good. Man, the fact that they're actually getting air and then landing, I think about tailbone injuries, aka toxic injuries. Look how much fun they're having. I love it. Oh, geez. I don't know how good that water was.
I knew you guys could have fun here.
Yeah, nothing gets the heart pumping like a brush with... nothing.
Uh-oh. I knew it.
I knew it.
Instantly change color. So I have patients that will come in that they just don't look the right color. Typically they're either green or they look like a hue of gray. Our job is to know what sick and not sick looks like.
I don't feel so good.
The quiet rivers in my tummy are becoming raging waters.
Upstairs or downstairs?
Both!
Uh-oh.
Out of the water!
Out of the water! Don't want them to accidentally have diarrhea in the water. Our poop has always got lots of different bacteria in it, and E. coli is one of them. If something is causing you to have diarrhea, it could be not just your normal bacteria that's in there, but it could be a virus, it could be a parasite, a different type of worm, like all different things.
Bart and Lisa will be fine after a little TLC. By TLC, I mean taking Lorexocortisone. And by little, I mean a 4-week intensive regimen.
Cortisone is a type of steroid. If you're having inflammation of the skin, you can use it as topical. It also helps with itching. Typically, you wouldn't want to use the steroids internally because it actually then calms down your immune system and doesn't allow you to effectively fight off infections.
Steroids? Are there any side effects?
Nothing serious. Maybe a little temporary weight gain.
Yes, there are long-term issues of chronic steroid use. You don't want that. Typically in the emergency department, we're dealing with one dose for anywhere between 3 to 10 days. So Simpsons, always perfect to talk about the medical situations that occur here. Obviously, you guys love this stuff, so continue to watch it. I appreciate it. Definitely binge watch this playlist right here. And as always, make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.